I see a very bright future. I think a lot of people at the conference are excited about it. I think that we're going to see expansion to a lot more indications, and probably the best use case for radiopharmaceuticals hasn't been discovered yet.
The future in nuclear medicine is all of the radiopharmaceuticals that are in clinical trials. There are so many that will come to help us, to help diagnose patients, monitor their disease, and improve patient lives.
I think the future of nuclear medicine is getting really personalized medicine where we can tailor treatments to each individual and have treatments that target their disease rather than just all of their tissues, especially in the field of cancer.
There's a lot of money going into drug development. I think the future is very, very bright.
I think in 5 years we're going to see a lot of expansion to other indications, a lot of cancers, even rare cancers, getting wonderful drugs and very different overall survival benefits. I think there's a real possibility we'll see some competition with chemotherapy.
Hopefully we'll get a lot more different tracers, different treatments, and access to all those things for a lot more people.
I think we're going to discover how the unique properties of alpha emitters or Auger emitters may help defeat chemo or radio-resistant cancers.
But right now I'm seeing that the world of theranostics is going beyond what it is there. People are talking about how to treat different tumors with the same type of drug.
I'm always amazed when I see the imaging technology and how we can see exactly where the cancer is, but we can't always kill it.
Yeah, I absolutely think that there's going to be a lot more advancement. There's already so many things coming out right now, including new radiopharmaceuticals and new treatments.
I feel this is the best period for the nuclear medicine because we have theranostic, which is very important for the management of the patient.
If I had a chance to travel to any nuclear medicine history, I would like to just maybe go back to the 70s because they were it's kind of primitive compared to like what we're doing now. So it'd be really interesting to see kind of the start of nuclear medicine.
I would like to go back in time and have a discussion with Sal Hertz because he is the originator of nuclear medicine today.
I'm pretty excited about what it is now, and I think this is where I want to be.
I think the future is more exciting. It's a revolution in therapies that a lot of patients are getting now. So I'm looking more towards the future.
I think the most exciting history of nuclear medicine is the future. I think where it's heading is the best place to be, so I'm looking forward to seeing that.
I would go back to the era where we actually introduced the scanners. Hal Anger, who was the first one who actually made the scanners, I would go back to that era and maybe make some changes so it can move faster through the time points.
Right now, the history around theragnostics and its progression to be able to help more individuals that have different types of cancer. So in the past, theragnostics was mainly focused on thyroid, but today it's evolution. So it's coming to help prostate cancer, and with those clinical trials, pancreatic cancer, pediatric cancers, and so right now is the most exciting time in nuclear medicine.
If I had a magic wand, I will make nuclear medicine cure every single cancer. Patients will be in remission for life.
To be able to get these new drugs to trial as quickly as possible.
Make nuclear medicine and all the things available to everyone, and that would be great.
I think if I had a magic wand, nuclear medicine would be able to image almost all diseases that have any specific biology or chemistry that we can target in the body, and hopefully treat most of them too.
If I have a magic wand, what I want really is to have quicker scans for the patient.
If I had a magic wand, then nuclear medicine would have a radiopharmaceutical for every major disease that affects all peoples, to be able to help diagnose and treat disease to make the world a better place.
I don't know how long it'll take, but I think nuclear medicine is going to be really good at diagnosing and treating a variety of conditions, cancer and otherwise, and getting very patient-specific and disease-specific imaging and therapies.